All right, everybody, we'll get started. Thank you for everyone that is here today. Again, in the panel on the right, feel free to ask your questions. The goal for this webinar is to talk 90% about telehealth for PTs and the best way to do so. And we're going to talk a little bit about right now and as everybody opens up, but a lot about the future, a lot about how we see people are implementing telehealth for PT groups. Daniel here, we started working with Daniel right when the crisis started, and I wanted to seek who would be the expert in helping PTs and telehealth. And Daniel was recommended by many people on different groups that I was a part of. And so at the very beginning, I'd like Daniel to talk a little bit about tele-PT solutions, and additionally, what are some services, what is it that you bring to the table for people above and beyond just something like HealthyRoster, which is a solution? You do a lot more on your angle.
Sure. Thanks, Michael. First of all, it's always a pleasure to do these chats with you.
Yep.
It's fun to get the word out and fun to just have conversations about this stuff because we're both dealing with it on a daily basis and working with clients, and it's kind of interesting and fun to reflect on what we're doing. So my group is Tele-PT Solutions. I'm a physical therapist by practice. I had my own practice for 15 years, and then I worked for a larger group for a few years and put together their telehealth program. And in doing that, I recognized that a lot of the platforms had great technology and really excellent tools for telehealth and video conferencing and scheduling, but very few of them really understood the patient experience and the practitioner experience and the practice owner experience. So that's what I do. I educate and train physical therapy practices, the owners, management, admin, and clinical on how to have a successful telehealth practice. And it's been a really interesting ride in the past couple of months. A lot of groups really went about it their own way. They got on either Zoom or started doing FaceTime visits and realized that was really simple, except as they did more, they realized it got a little more complicated. So this is part of your practice. Telehealth needs to be a part of your practice for the moment and going forward. And it's essential that you have a plan and understand the game that you're playing, really. I mean, the rules and regulations need to be understood. Right now, it's kind of Wild West, and things are just very free and easy, and you can still do those FaceTime chats or visits. You can still do those, non-HIPAA compliant Zoom visits, but it's only a matter of time before that's going to be HIPAA regulated again, and you're going to have to be on a HIPAA compliant platform like HealthyRoster or one of the others.
And I think what's important there is the advice I'm hearing there is you want to be on a HIPAA compliant system now, because for a lot of people, they're implementing this for the first time with their patients. And if you implement something like you said, FaceTime or something else is not HIPAA compliant, they get comfortable with that. Now you're going to have to shift internally in your side of your business, but also with your patients. So that's important. What do you see when we think of that, implementing that first steps? Any quick tips you would say right out the gate to say, okay, you're implementing this right now?
In terms of starting a telehealth program, first of all, just have your processes down, know how you're going to go about scheduling visits, how you're going to do setting up a visit with a patient, make sure your staff is trained. Most importantly, as far as getting a platform, it's most important that you have one that's reliable. It needs to be easy for the provider and the patient to get onto a visit, and then it has to be reliable. It can't be dropping calls. It can't, that is the most frustrating thing. That's the thing that causes patients to lose their interest in telehealth and say that they don't like telehealth. That's the thing that causes that to happen the most. And it also affects your providers. If your provider is constantly being hassled by having to deal with the technology side of things, then they're going to get discouraged and they're not going to want to do telehealth visits. And
right, easy to use. I mean, and through this conversation, I will, because part of this I've told everybody, we'll talk a little bit about HealthyRoster. We built ours easy to use. There is options, as we all know out there, that you have waiting rooms and you have these different versions. We built ours where it's a simple one click and they're in, because and our selling point is that ease of use. What about some other features that you've heard that you would say this is a good feature to have as well?
Well, other features are it's important for the provider to be able to one thing is to be able to share their screen. If they can share their home exercise programs or a video of an exercise with a patient, that's always helpful. Um, Doing things like also transferring documents, being able to do that on a secure platform. Because think of a patient who may never come into your office. If they can share documents safely, securely through their platform, then that makes things a lot easier for you, as opposed to them having to, I don't know, drop it off at your office or send it by mail. There is still mail. You can still mail things, but
Yep.
it's a lot easier if they can transfer it to you, right? Yeah, I mean, those are some of the features that I like the most. Yeah. What are some things that HealthyRoster offers
Yeah, and
that
I would tell
you
you
think
that,
are like the real game changers?
yeah, I mean, one that we did for a very large PT group that when we first started doing focusing on after the crisis, they said, hey, we have people joining with their phones. We've talked about this. You'd like them not to have it on their phone, but some people do. So we made the ability to like choose what camera they use. That way they can flip and do that. We have the sharing of the screen that is very easy to use. I'm using Zoom right now. We use for this meeting. Our sharing of the screen, I would say, is easier to do than
Mm-hmm.
Zoom. Zoom's easy, but the whole logging in and sharing. You can share documents through Healthy Roster. We have the ability to do that to groups, to single. We have the ability to do the meeting with more than one person. We'll talk about that in a minute. That's a great thing. But just ease of use and that ability to share your screen is probably the biggest thing, because it's almost like we joked before. It's like if you did Peloton without the person there doing it with you, right? It helps to
Yeah,
have that person
sure.
showing you. And as the PT, you don't want to be doing the exercises every day. That video helps. So,
That's right.
um, so legal now. We're far into this now with Medicare and everything. Have you heard any recent updates, recent changes that people should be aware of?
Nothing significant has changed in the past couple of weeks, except that a few of the national payers have extended their waivers for copayment and shared expense. So, for instance, Aetna, Cigna, and United Healthcare have all extended till at least the end of July. One of them, I think, is till the end of the year. I have that. I'm not sure which is which, but they're recognizing that telehealth is significant, that this emergency will probably extend at least till the end of the year, through the fall and into the winter, and it's going to be necessary to continue to pay for telehealth visits, and secondly to the waiver on coinsurance and shared costs, because people are hurting right now, and that's part of that. I think as far as the payment for telehealth physical therapy and rehab services, I'm hearing more and more that payers are looking for reasons to continue to pay for telehealth. So, for instance, Tennessee Blue Cross Blue Shield has actually said that they will pay for telehealth beyond the health emergency. They will permanently be paying for telehealth visits for all of their services. So I think a lot of other payers will follow suit. And of course, if Medicare agrees to do that, that'll open the floodgates.
Yep, huge.
Yeah.
One thing, and since a lot of people are opening back up, and so a lot of people also on this call are PT groups that are always looking to advance, to
Mm-hmm.
grow. And I'm hearing frequently how this is going to be 20 to 25% of the future for a lot of groups. Why do you think that is? And groups that are thinking that way, why are they thinking differently than others?
Well, funny you brought that up, because we've talked about this before, right? And I think about a month ago I came to you and I said, I've crunched the numbers and I've run it through in my head 1,000 times, and I'm pretty sure that the future of medicine is going to have to be, every surviving practice is going to have to be at least 20% remote telehealth. So today, as I was telling you, I was listening to a webcast on the future of medicine, how telehealth is going to be involved in evidence-based practice. I'm sorry, on value-based care and those sort of models. And one of the real experts in this field, his name is Naji Prabhu. He is saying that all healthcare will be at least 30% of visits will be remote going forward. And this is a guy who's seen he's been in telehealth for years, and he's seen the changes, and he has seen the effect that this is having and the impact on providers and payers. Saying 30%. So maybe I undershot it. We'll see. The time time will tell. But figure 20% or more of your practice will have to be remote. You still, even beyond the emergency, whatever the end to that is, there's still going to be people who should safely in order to be safe, should not come out to a physical therapy office. Right. They shouldn't necessarily be leaving their homes. They still need care. Doctors are prescribing therapy. They need movement. And you're going to have to cater to them. I mean, you're going to want to cater to them. You want to help people like that. And if you don't do it, someone else is going to. There's going to be a market for telehealth, and it likely will be in the PT space. Let's call it 25% of a physical therapy private practice will need to be remote in order to meet the same kind of demand that they were meeting before.
And two things I would think there. One is, during this COVID crisis, there's been a lot of just everyday healthcare as well has gone the full remote telehealth. So a lot of people, it's kind of like smartphones or FaceTime or anything. Everyone is getting comfortable with it. And as that comfort gets there, there will be an expectation. And if you're not offering it and promoting it and marketing it, someone else in your area will. And so you want to be that group.
Like you said, it is becoming more. It's just become normalized. People are getting more and more comfortable with the technology. They're getting comfortable with the video chat. They're getting comfortable with getting their care this way, and they appreciate the convenience. There's definitely going to be bigger opportunities in telehealth, and there's so many more opportunities that you can take advantage of as a practice if you have the infrastructure in place.
So when you work with a practice, what do you see as, let's say this was a call with a practice, what would be like the first thing, a big tip or thing they need to get in place in terms of, go ahead.
Of course it's important to have a platform chosen. Right. So, do your assessment, figure out what your needs are, and choose a platform that's right for you. It's going to meet your needs in terms of the features that you want, the performance level that you want. And as you were saying before, by the way, if there is a market of 25 or 30% of a practice or all practices being telehealth, the level is going to have to improve. So the quality of your platform is going to need to be top notch. Just like you wouldn't want patients walking into a messy office or with unpainted walls and dirty carpets. You're going to want a neat, clean telehealth experience too. So what do practices need to do as the first thing? They need to have a plan. They need to know what they're doing. So whether it comes from within your practice, if you assess your situation, your current situation, your resources, your long-term goals, put together a plan and know what you're going to do for the short term, that Band-Aid for this moment, and how that's going to look in the future. And the reality is that the rules and the laws are changing. So, expect to have to pivot or have to be agile and have to really continue to reevaluate this over the next 6 months and a year. I designed a policy and procedure manual, which was originally designed before COVID. Now it's evolved into this COVID moment, and it's also changing and evolving as we go forward. So for my clients and the people who have purchased this policy and procedure manual, it's a living, breathing document. It changes as rules and regulations change. So I'm staying on top of that because I need to. This is what I do, right? If you want to do that and run your practice effectively and legally and ethically, you should be doing that as well. And if you choose not to do that, make sure someone else is doing it for you.
That one thing I was going to say is, you've written a playbook on this, and for anyone that is looking to do it, it's not the best thing. I wouldn't advise on trying to figure it out on your own. You can shorten your time of learning, and it's kind of like being a parent. The kids are like, I'll do it myself. It's like, no, you've been there, Daniel. So, I've
made the mistakes for you.
Exactly. So some of the people still have some questions about, billing
Sure.
and how to bill. We even had one came in now. What modifiers are needed for a PT eval, and
Okay.
the CPT codes. So why don't we do a broad discussion on the CPT codes and the modifiers and all
Sure.
that?
Sure. I'm just grabbing my cheat sheet here. Every payer is different, so that's the first answer. And with any patient, check with your payer, just like you would if they were coming into your office. Make sure that they have the benefits. Make sure that they have telehealth benefits. At the moment, I believe almost every payer nationwide is paying for telehealth in some shape or form. Almost. Check with your payer. Check that they are accepting your normal physical therapy or occupational therapy CPT codes, which most are accepting. Most of them, including Medicare, is. And then you'll have to put a modifier on most claims, whether it be for Medicare, it's 95. They want to see a place of service 11. That's Medicare for all claims. And every payer is a little bit different. So some want to see 95, some want to see GT modifier. Some want to see the place of service 11, and some cases they want to see the place of service 02. I believe it's Aetna. Maybe it's Blue Cross. Blue Cross in Florida, for example, wants to see place of service 11 for their commercial patients, and they want to see place of service 02 for their Medicare Advantage patients. So check with your payer. It can be very specific, and you don't want to have denied claims. You don't want to have to wait to get paid, things like that. I mean, and in every case, almost every case, you should be getting paid. In New York for a long time, Excelis, Blue Cross Blue Shield, was denying claims. And then for a while since then, in the past month or so, they have not been paying the coinsurance, even though New York State law says during this emergency, they have to pay for telehealth and there is no shared cost associated with telehealth visits. So check with your payers, make sure they know. And if you don't get the answer you want to get or you expect to get to the next person. Speak with the supervisor. Make sure you're speaking with someone who is informed.
Exactly. We talked about that before. Don't let the person who can't say yes say no. So make sure you keep on going through. I think the other question I had there was about the point of sale. Does the POS need to be set to telehealth? Does the POS need to be set?
Place of service.
Yeah, I said point of sale. I was thinking about something else.
Yes, it's same idea.
Yeah.
Does it need to be? Does it need to be what?
Does it need to be set to telehealth?
It depends on the payer. So place of service for an outpatient visit, in-office outpatient visit, is 11. Some payers want to see 11 on all the claims. Some payers want to see 02, which indicates telehealth.
Right. Right.
In most cases, what I've seen is it's mostly 11 still.
And you've stressed this, and I know you just said it, but I'm going to say it again, and we can talk more about it. But you said before that before you see a patient to call and verify everything that needs to be done. We advise that as well. Yeah. And some of the larger PT groups we work with, they have someone that right now that's all they do. They're designated to that because they've seen if you don't do that, you're going to have an issue.
Oh yeah, I mean, as a practice owner, I always every patient that came to us, and look, most PT patients are going to come to you for multiple visits, right? So whether it be 8 or 10 or 12 or longer, if you check their benefits one time, typically that's enough. Most practice owners also know that you do have to recheck benefits at the end of the year or the beginning of the next year, right? To verify that they still have the same benefits. And also make sure all your visits are authorized. You shouldn't need a specific or a different authorization for telehealth. A lot of practices will follow a hybrid model where patients will do maybe one visit in office per week and one visit by telehealth per week. There should be no differentiation in the authorization for that. The benefits shouldn't be any different. As soon as you know that telehealth is okay, you should be able to see them for telehealth visits. Your claims might look different because you're saying telehealth or in office, but that's the only difference.
Reminder for everybody on here too, I see your questions, so just keep on asking questions down there. And again, Sean, you can Slack me the questions that they come through Facebook Live. One thing that always, every time we do this, you answer this question in a way that I almost feel like it could be a script, and that is to that patient that is a little bit concerned about doing a telehealth visit, or even to the practice, you always talk about selling your value above and beyond just go through that whole, pitch there almost, or how you explain the value so then the patient feels better.
And yeah, it should be understood by your practice. And when I say practice, it should be all clinicians, all admin staff, all management, all marketing staff should understand the value of a telehealth visit, that these are real visits. It's not a home exercise review session. It's not a chat session with the patient, which that can be part of it, but no different than when a patient comes in with chronic pain and you sit with them for 5 or 10 minutes and really talk about what's going on in their life. That's perfectly okay. Right? But it also should be a treatment session. So much like you would do soft tissue work with a patient, you're going to instruct them through a soft tissue work session. You're going to instruct them how to use that foam roller, how to do some self massage, maybe with a massage device or a spoon on some real tough soft tissue adhesions. And you're going to take them through exercises and functional activities, and you're going to progress them. And if you're doing an assessment, you're going to do a real assessment. And you definitely have to modify how you do it. It's going to be a little bit different than touching and being in the same room with a patient, but it is a real session. And you're going to find, if you haven't done any yet, you're going to find it's really effective. And I scan my PT Twitter on a daily basis. And every day, at least one manual therapist, someone who was fully a manual therapist, notes something about how, I just didn't believe this was really going to work. I had no idea it would be this effective. So, what PTs bring to the table, and we know this, but we don't always acknowledge it, okay, it is our knowledge, it's our problem-solving skills, it's our compassion, and it's our communication, okay? So all of those things are still there on a telehealth visit, on a remote visit. You're still connecting with the patient. That's the most important thing. And having and sharing your knowledge, your problem-solving skills, your compassion with them. The only difference is a portion of your communication, right? So your communication it's verbal, it's tactile, and it's just being in person with the patient, right? So you're taking the one thing that is not there is that tactile component, and that's a small portion of all of the things that we do, and what actually bring value to a patient, and what actually help patients get better. So that's all we're taking away, and it doesn't have to be every patient, every visit, right? They still can do in-office visits as part of their program. And I'm encouraging, as we come off COVID and practices are opening and we're getting people back into the clinic, I think we should be encouraging patients to come into the clinic. That's important for a lot of people. Most patients. But practices really need to be thinking about how they're going to start weaving telehealth into their everyday protocols and approaches and patient management. So if you have I used to say, if you had a patient who had a total knee replacement, right? It's very challenging for them to get to the office. They're probably not driving. They're depending on a family member or an ambulette or a taxi. And those things are definitely a little iffy right now, right? Ambulettes, taxis, who's doing that? Or Ubers, right? Who's doing that right now? So, if you can make it easier for them, where they do 1 or 2 visits in the office and then 1 or 2 visits at home remotely, that makes life so much easier. So I said this to a group yesterday that I was working with, and they were like, you know what? If my grandmother had a total knee replacement, for the first month, I would want her to have PT every day. Every day. So they took what I had said and they turned it into, we're going to do 3 in office and 1 telehealth per week, or 2 office and 2 telehealth. And we're going to give the patient those 2 options, and that's it. Like, you can do 2 in office, 2 home, or 3 in office and 1 home. You're doing some telehealth as part of your rehab. It's going to be, they want that extra touch. They want to be able to help that patient along a little bit more.
And I think the point of this webinar and the point of what you said, and I love it, is it's not that we're trying to replace what you're currently doing, right?
Yeah.
It is the way, and I just wrote it down myself here, is it's to strengthen the care.
Sure.
It's to strengthen what you're doing. And the reason you can do it now in a way you never were before is because of the telehealth adoption across the country.
Yep.
I can tell you my family, everyone in my family, we've done some version of a telehealth visit over the last, 3 months. So you
Yeah.
have, my mother is comfortable now doing that, right? Before she wasn't. So you have people that are now comfortable. They understand it's not something out of left field. And so it's an opportunity to strengthen your PT group and putting that in like that practice you were talking about. That's great. What other tips would you say? And so, because one of the things you think we talked about it, you'll have some PTs that are all about it. Then you have like that one or two that are, I don't want to change.
Sure.
What do you say to that group, or what do you say to that PT?
To the practitioner, well, in the past couple of months, they pretty much didn't have a choice in some parts of the country, right? Their office was closed. If they wanted to work, they had to do remote visits. I historically, I've believed that it's not for everyone. Not every PT is going to embrace telehealth. And maybe there's a place for not doing it, for not doing telehealth in your personal practice. If an office is thinking, if a full practice or an office or business is thinking of not embracing or utilizing telehealth, I think you're going to miss out on business. I think you're going to miss out on helping people. It's an opportunity to help people. And like I said before, it really is about understanding your value. We sometimes forget what we bring to the table. A lot of PTs really think that the most valuable thing and the only valuable thing that they're bringing to their patient is the tactile component and the touch. And look, I get that, because that's what feels the best to the patient. And as a PT, you're like, you get that sort of instant gratification of helping somebody right there on the spot. The reality is that the carryover and the real healing process goes on through education and compassion and training and helping a patient help themselves. So I guess in answer to your question is, you can be very effective, and you can really be helping your patients more by using telehealth a little bit more in your practice.
And that last part about compassion and caring and all
Yeah.
the additional part that the practitioner has in their skill set. If you pride yourself in that and that's what you believe in, then moving part of the business or adding the additional layer of telehealth only is better for your patients. And
Yeah,
so
and it's a skill set. Communication is hard. It's challenging. Um, it, I think PTs and other practitioners use some of their manual therapy skills as a crutch or a bridge for communication. You don't have to be communicating, talking, demonstrating too much if you're doing the work.
Mhm.
But then you're also, you're not teaching that person to fish. You're just giving them one. You're giving them a fish, right? However the expression goes. Teach a man to fish, and he'll eat well forever.
Yep. So when I think through, your service, why don't we talk a little again about what you provide to a PT group?
So I'm a consultant, trainer, educator. I work with PT practices to help them launch, develop, grow their telehealth practice. And look, it's, as I said, I think it's going to be, let's call it 20 to 30% of every PT practice, surviving and thriving PT practice, is going to have a telehealth component. And it's going to need to be part of what you normally do. So your everyday operations, you're going to have to weave it into what you do. It's going to be regulated. It's going to have to be ethical and legal and efficient. And so what I do is I educate the entire practice on how to do that. Management, administrative staff, clinical staff, on how they're going to be more efficient without taxing their system. They're helping more patients, they're helping them more effectively, and they're doing it by having a system that works with telehealth and in-office visits. Now, one realization I'm coming to is over the years, I think PTs have tried to, in order to be more efficient, we've often tried to do that in the clinic and create not necessarily shortcuts, but efficiencies in the clinic to be able to see more patients and help more people. I think there are some limitations to that. there's only so much you can do without compromising care. But where we can make a big difference is in our administrative efficiencies. So if you can improve your operations and your flow from, for example, from your telehealth system to your EMR to your patient to your practitioners, you can make things go a lot smoother. And I know that Healthy Roster has a very smooth operation in terms of scheduling a patient and getting to a visit and making it really easy, so that PTs are not spending an extra 10%, extra 20% of their time getting into a visit or starting with a patient. Those are killers. 5-10 minutes here and there, any PT will tell you can throw your whole day off. So I help with that. I think that's really important in this whole process. Everything else I've said, policy and procedures, but if you can create efficiencies, and telehealth is one of the things that's really going to help a lot of practices do that.
Nice. I will say, any more questions, feel free to pop them in there. I will say, one thing we've recently started doing to show the ease of use of our system is that if you are looking to use Healthy Roster, we actually will schedule our meeting with you and us through Healthy Roster. So you can experience a visit just like your patients will. And it's kind of like, it takes 10 minutes. And once we get on, because it's like, you saw how easy that was. You saw how you just click the button. You got the email invite. You got a calendar invite. One click and we're here together on the screen. That's how easy we make it, because as Daniel has mentioned, that is the crux of everything. If we make it easy for the patient, you'll have that adoption. You'll strengthen your group. Anything else you'd like to say today, Daniel?
Well, I think, first of all, I just want to build on what you just said. I think that's a great idea for practices to do with their patients.
Yeah.
So you want to show a patient how easy it is. You can have multiple patients on a call at the same time, right? So two things with that. That feature I really like. One is you can schedule a webinar, an educational program for your patients on how to be a good telehealth patient through Healthy Roster, right? You show them how to get on to a visit. Now they're on, and you explain to them how an actual visit would work. I mean, it's basically tying everything all together, right? So that's one thing. That's a marketing tool. And another efficiency that I like with telehealth is group exercise sessions. Great marketing tool, great education tool, great treatment tool, and also building communities around your practice. So the fact that you can get multiple patients or clients on one call, you can do group exercise sessions for your arthritis groups, your Parkinson's groups, your chronic pain groups. And I think that's, if you were not already doing that in your office, it's definitely something that you can be doing remotely, and it's super efficient too. I believe Medicare pays about $20 a visit for a group exercise session, which can be like 30 minutes. I mean, that's a real efficiency there if you get 10 people in.
I think this is where, people can reach out later, as well as that there's so many ways to utilize this to grow the business. Almost everyone on here today, based on the outreach we did for this, are groups that are looking to grow. They're looking to always improve. And this is probably the easiest or the best way now and for the future, in the next 6 to 12 months, is the easiest and best way to grow your business. I think about, if you put this out on Facebook, if you put it in your Google My Business, if you advertise that you offer visits via telehealth, that shows that you're forward thinking and gives peace of mind to those patients.
Yep.
Well, with that, I don't have anything else. I think the day was a little different. If you need to know about codes, if you need to know about all those things, we've been doing this for a while. There's on our website, we have a resource guide. Daniel's got a living and breathing resource guide as well. And I would just say, if you are looking to do telehealth or maximize how you do telehealth, reach out to Healthy Roster. We'll do a quick demo to show you how it works. And also reach out to Daniel, because he's got the roadmap, the playbook, however you want to say it, for success. He's been doing this for years, and you can have peace of mind. We do have one question that just came in. Let me see this real quick. It's funny. It's one we randomly talked about last time, and it was like, oh, we should mention every time. Headset equipment, like devices. Remember we talked
Sure.
about, I have it
Yep.
right here from my phone, right? But, you know.
Yep. I have one of those. I like this. One of these
There you go.
adjustable metal phone stands. I like that for providers and patients. I mean, it's great for a patient because the patient can then either tip it forward or tip it back, depending on what part of the body you want to be able to see. I use a desktop USB mic, which works great. Logitech, a Logitech 1080p camera, which is really clear, I'm told, and a set of Bluetooth headphones. For me, it helps drown out the sound. It lets me tune in to any Zoom call or any treatment session that I'm doing. And of course, the volume is really clear in my ears. So I like that. I think I think having a desktop mic and wireless headsets, Bluetooth headsets, first of all, it dials me into the session, and it's just it creates a much more professional presentation than using your laptop mic and laptop.
100%.
Well, yeah.
Yep. I'm using my mic because my AirPods have trouble with Zoom right now. I'm having a lot of issues with Zoom. So I'm not using it, but I wear Apple AirPods, the noise cancel ones. And then I have the same Logitech 1080p webcam. I haven't looked recently, but I know when this first started, they were about 5 times more expensive than they used to be. So
yeah, they're not bad now. I think they've come back down.
Because everybody was grabbing them. Yeah, that's cool. And then I'll be curious, your iPhone holder, does it have your logo on it?
It doesn't. It actually has someone else's logo on it. I got it at a trade show, at a PT trade show. So I'm not going to tell you whose logo it is, though.
I like that. I like it for all these groups on here. They could just put their logo on one of those, and when someone comes in,
I'm gonna bet that at CSM and at PPS this coming year, if there are actual live conferences, there will be several practices and several groups giving these out.
Yeah,
not just one. There'll be multiple ones giving them out.
You'll get
the hottest item at the conference.
Whoever's selling those, they're gonna have.
That's right.
All right, no more questions. Like I said, reach out to both of us. We'll be able to help you. Thank you for being here. Thanks to everybody on Facebook Live as well. And thank you, Daniel.
Thanks, Michael. Thanks for having me again. Great talking to you.